Broadcast is now starting. All attendees are in listen-only mode.
Well, welcome everyone. This is Jason Zaidema of NAMA and of ICMA. I think we have a good number of folks who are already signed on. I think there's about 50 who are going to be joining us today to listen in on this conversation. This is a conversation with some representatives of the Cruise Line Industries Association, but certainly talking about cruise ship seafarers' welfare. Since the coronavirus crisis began, there's been a deep impact on the cruise industry around the globe, on crews of those cruise ships, and certainly on their families and the welfare organizations that take care of them. In order to have a conversation, we've invited a few special guests from CLIA, which is the trade association of more than 50 cruise lines representing more than 95% of global cruising. And I'll introduce our very special guests in just a few moments, CLIA Vice President Donald Brown and Senior Vice President Brian Salerno. Before we begin, I thought I'd invite our newly minted president of NAMA, the Deacon Paul Rosenblum from Charleston, South Carolina, to say a few words of welcome and to help us understand why this conversation is important. Thank you, Paul.
Thank you, Jason. Good morning or afternoon or evening, as the case may be, to everybody. We welcome you to this webinar in conversation with CLIA. A special thank you to Donald Brown and Brian Salerno for being so generous with their time today. NAMA exists as an association for three reasons: to be a network for port ministries, to provide professional development opportunities, and to be a common voice for seafarers' welfare. This webinar today touches on all three of those. As a network, we are very happy that NAMA and ICMA members from around the world are on the call, and I look forward to hearing your voices. For professional development, we hope on this call you will learn more about the current state of the cruise industry, but especially how we can stand ready to respond in the coming months to serve the well-being of cruise ship crews. Finally, as a voice for seafarers, we are so happy that senior CLIA representatives are willing to speak with and also hear from us. It will be important to hear your questions and your stories on this call. Thank you all for your dedication to seafarers' welfare.
Thank you so much, Deacon Paul, for those words of welcome to everyone. So Donnie Brown and Brian Salerno are both presently working for CLIA. Donald Brown is Vice President, Maritime Policy at Cruise Lines International Association in Washington, D.C. He develops, presents, negotiates, and implements global industry positions on legislative, regulatory, and policy matters involving security, environmental stewardship, and health. He leads delegations to the International Maritime Organization, where he represents the global cruise industry during international treaty negotiations and other matters. He's also the designated secretary of the CLIA Global Committees on Maritime Security Matters and Marine Environment Protection Matters. Prior to joining CLIA, he served in the U.S. Coast Guard at the rank of commander. Brian Salerno is Senior Vice President for Maritime Policy at the Cruise Lines International Association. In this capacity, he coordinates industry positions on technical, regulatory, and policy matters related to cruise ship safety, security, and environmental stewardship. He came on board with CLIA in December 2017, and Brian also served 36 years in the U.S. Coast Guard, retiring in 2012 at the rank of Vice Admiral. Donnie and Brian, thank you for being with us this morning or afternoon, evening for everyone on the call. Thank you for being with us.
Our pleasure to be here. Well,
if I can just introduce the way we want to proceed today for everyone on the call, what I'd like to do is invite Brian and Donnie to say some opening remarks for the next few minutes. And then for the rest of the hour, I'd like to give everyone a chance to ask questions. And so questions can be asked in a couple ways. One is you can put them in the question box, and I already see Leslie Warwick from the Fort Lauderdale Seafarers House has already asked a few questions. We'll get to them in a few moments. That's the best way to just pop questions in there right away. But there's also going to be a chance to hear from you. And what I'll be able to do is open your microphones later on. And so on the GoTo meeting control panel, you'll be able to see that your microphone is open. I have the power to open your microphone right now. Everyone's on mute, but when we get to that point, so if you have a question, I might ask you to open your microphone, and then we can hear your voice and hear your stories. So we'll want to hear questions, but also comments. And if you've had a great experience or a difficult experience, if you'd like to share, that will be so important. So for some opening remarks, Brian and Donnie, please take it away.
Okay, well, thank you, Jason. I think I'll lead off and then ask Donnie to chime in here. We do have a few slides that we'll go through, but first, let me just thank you, Jason and Paul, for putting this webinar together. The reason that both of us are here is that the issues we're going to talk about today are of great importance to CLIA and importance to our members. And I fully expect that I will get as much out of this, and Donnie will get as much out of this as we hope you get from our perspective. We recognize that, you know, we're several layers away from the deck plates. The information we get is through, you know, a number of filters. But when we have the opportunity to hear from you, who interact directly with seafarers, we're getting the unvarnished truth. And I think that is extremely valuable to us. So we thank you again for putting this together, and we thank all the participants for joining this webinar. And we very much look forward to hearing what you have to tell to us. But we thought we'd start off with just a quick summary of where we are, particularly since, you know, COVID, you know, became something we've had to deal with, the effects it's had on not only our industry but on our seafarers who make our industry operate, and then we'll also talk a little bit more about, you know, what we've been doing in terms of seafarer issues. But I think most of you are aware, you know, we voluntarily shut down our operations from the U.S. Back in March. It was 14 March. The industry voluntarily suspended for 30 days. It coincided roughly with a no-sail order issued by the Center for Disease Control, which also went for 30 days. They ran pretty much concurrently. We were not included in the first no-sail order by CDC, but when our first 30-day period expired, CDC reissued their no-sail order, and we were included in that. So that's what we're operating under right now, or I should say not operating under right now. That, of course, affected the United States, nowhere else in the world, but in reality, operations began to shut down all over, you know, the world and places where cruise ships operate. And many of the same issues that we've experienced in the US are experienced elsewhere. Crew disembarkation, passenger disembarkation became the primary issues we had to help manage. It was initially focused on passengers. It was extremely difficult to get everybody ashore. Again, when we suspended operations on 14 March, there were still quite a few ships at sea, and it took a number of weeks for all of them to come back to a port where passengers could safely disembark and get home. Then, of course, the problem quickly transitioned to one of crew. You know, unlike most, you know, merchant ships, you know, we have, you know, large crews. Many of them are dedicated to hotel services, making the experience on board for passengers a pleasant one. But without passengers on board, there isn't a whole lot for them to do. So the excess crew members, and they're all seafarers within the meaning of the Maritime Labor Convention and entitled to all of the protections under the MLC. The object was to repatriate them and get them home. And as the virus continued to expand around the world, this became just extremely difficult to do. There were travel restrictions that were imposed by many countries. Even when travel was possible, the mode of travel was severely restricted. From the US, for example, it became virtually impossible to fly a crew member back to their home of origin on commercial aircraft. That had to be done through contracted aircraft. It sounds fairly straightforward. It is not. Just arranging for the aircraft, getting all of the proper clearances, extremely difficult. There were often last-minute cancellations by the aircraft company. So crew members went back and forth. And then the whole issue of, well, what about, can you even send people ashore if there's a case of COVID on board? Does everybody on the ship have to be treated as a contact for that one person? So all of these things complicated the process, and it's taken months. We are, I think, happily getting to the point where most of the excess crew has been repatriated. Not all, but within the last several weeks, there have been thousands repatriated. Sometimes through some fairly desperate measures by the cruise lines. We've seen a number of lines, actually use their ships as the means of repatriating people because they could not get them on aircraft, so they just sailed them halfway around the world to the Philippines or wherever to repatriate them there. Not that that is entirely a smooth process either, but that's the lengths that they've had to go through. For those that do remain on board, there's been a whole new set of concerns. Within the US, for example, there's recommendations from the CDC about social distancing and separation of crew members. So they're essentially all in individual cabins, which sounds great. They're spread out, so they're, from a medical standpoint, well protected, but that creates a sense of isolation and psychological stress. And it's been very worrying for our companies and for anybody involved in the management of crew. We've even throughout the industry have become aware of several suicides, which I think is a sad but very powerful indicator that people are psychologically feeling a tremendous burden through the isolation and the inability to really even know what's coming next. How long will they be there? So with excess crew, if they don't have anything to do and they're in isolation, they're not allowed to use some of the amenities on the ship because of public health reasons, like the gyms and crew bars. Any type of social gatherings been prohibited. It's really not a very pleasant experience. So if we can move on to the next slide. This is something that the crew issues are not unique to the cruise industry, but I think they are exacerbated in many ways because, again, if you're on board and you're not really working, you've got nothing to really focus your mind. Bad things happen to you psychologically. But as this issue, the COVID problem has spread around the world, it has affected the entire maritime industry. And it's gained the attention of the IMO, the ILO, and international bodies like the International Chamber of Shipping. But for us, and here you see, the Secretary General of the IMO, Ki-Tak Lim, really making the case that nations need to treat seafarers as key workers and to help facilitate their repatriation and also crew exchanges. Because at some point, people have to get off these ships, even if the ship is working, and they need to be changed out, and that has to be facilitated by maritime nations as well. For us, again, we've got a lot of crew members in our industry. 225,000 crew members, 100 different countries. So you can imagine the level of complexity in repatriating crew to just multiple countries. Any given cruise ship may have crew members from 50, 70 different countries. So they all had to go in various places. And again, the barriers were commercial flights. In many cases, home countries would not allow their own citizens to enter. And in some cases, people were not allowed to even get off when they were in port. So I'm going to ask Donnie to kind of fill us in on some of the things CLIA has been doing, just in the face of, all of these restrictions and barriers. So we'll go to the next slide and to Donnie.
Thank you, Admiral. Appreciate that. Jason, Deacon Paul, thanks for the opportunity to be here and present to members within NAMA and ICMA today. Like Brian said, this is an important opportunity for us to hear from you as well. So once we finish with the slides, look forward to your questions or comments or feedback for us. Since we suspended our operations in mid-March, and we have been working closely with the International Chamber of Shipping, other shipping associations globally, to understand the impacts, as while there are some unique things for our sector with regard to COVID-19, there are impacts that are common throughout the global shipping industry, from which we benefit from having a common platform to exchange ideas, leverage different capabilities, and working with the International Chamber of Shipping is one of those. It's provided us the opportunity to put forward recommended guidelines to the International Maritime Organization, which I think in large part informed those quotes and stats from the Secretary General of IMO that Brian just spoke to. And it's important for our voice to be part of that global shipping alliance as we try to tackle these issues with crew change protocols, with leveraging different governments within areas of the world where ships operate in order to try to help facilitate opening of borders, easing of restrictions, perhaps on whether it's visa issues or whatever may be in the way of returning seafarers to their home countries. That global industry aligned voice is helpful to do that. So we've been proud to participate as part of a crew change task force. For us, it's mostly been about repatriation, less so about crew change, but increasingly as this continues on, those seafarers on board will need relief as well. So new seafarers coming out to relieve them and give them a break, it remains important as well. We've done this through weekly calls with International Chamber of Shipping as well. The IMO, the ILO, the WHO have been involved in these conversations as well. It's really helped us to better understand that interface of evolving health guidance related to COVID-19 as the international community continues to learn more all the time, and to put that in the context of what these international UN bodies are able to do by way of exerting leadership and influence over what member states do with regard to seafarers from their countries. From where Brian and I sit in the US, one area that's had specific focus for us is the interaction with the Centers for Disease Control and Prevention in the United States, a very important entity from the perspective of being a global leader on health issues, but also one with which we have a regulatory role and the need for cooperation so that we can find ways to disembark seafarers, to make it the operating conditions on board both acceptable from a public health perspective, but also without imposing undue burdens on the seafarers themselves for those ships that are operating in and about the United States. And that has clearly been the focus of cruise lines during this period of suspension since mid-March. As you know, the conversation with the CDC really isn't even touching onto the resumption of operations at this point. It's all been looking at the present and trying to find ways to mitigate the impacts during the period of suspension. So that remains an ongoing effort. We continue to look for and welcome increased interaction with not only the CDC, but other global regulatory authorities, global health authorities, in order to ensure that the way we can provide for the optimum safety and health of crew members on board remains paramount. And it's a way to demonstrate our ability to do so in the future when we do resume passenger operations at the appropriate time. So I'd like to just leave it there as far as an update from CLIA from Brian and I, but hope that maybe through some questions we're able to learn a bit from you today as well, or maybe provide some answers to specific questions that you have. We'll endeavor to do that. Thanks.
Well, thank you both for that introduction to some of the key challenges and some of the key movement forward. And indeed, we have the next 40 minutes to ask and answer questions. This is your prime opportunity for those listening to ask those questions that you've been having. Certainly, anyone who's been watching the news or listening to finding news reports online, you can find all sorts of different news from about the cruise industry in the last few months, and now you have a chance to get some answers, perhaps from those who have some knowledge directly from the cruise lines themselves. So in order to ask questions on this system, you can go to the questions box and ask questions. And I see some questions from Leslie Warwick down at Fort Lauderdale, Karen Parsons from Galveston, Texas, Geronimo from Barcelona, Paulo from the Philippines. So we have the whole world questions, and I'll start with one from Leslie Warwick down in Fort Lauderdale. She asked a few questions, but the one I'll ask: in discussions between CLIA and the CDC and other decision makers on the issue of protocols, will the transition of seafarers from ship to shore and back again be included? Could certain centers, seafarer centers, become the quote-unquote clean zone for visiting seafarers to enjoy some shore leave? How would that work? And any comments or questions, Donnie or Brian?
Okay, well, I'll start and then ask Donnie to kind of fill in. Right now, our discussions with the CDC have been limited to this period of suspension, this operational pause. And under the no sail order, all of the cruise lines were required to submit a plan to the CDC detailing how they would manage crew issues with a view towards maintaining their health and not imposing a burden on local health authorities while ships are either anchored or moored, in a U.S. port. As far as shore leave is concerned, it's been a real challenge to get to a point where we can get crew members ashore. I think we would all like to do that. We would certainly like for them to be able to take advantage of seafarer centers. To my knowledge, that we haven't been able to get to the point where that could be just a regular feature of life on board during this period. As we look towards resumption, we certainly hope that that would be something that could be factored into the normal experience for crew members. But I think as we, assuming we are able to resume operations, probably it won't be before September 15th now, because the industry is just voluntarily suspended in the US for an additional period of time. We would hope we could get to that point, but I think initially, there's going to be some pretty strict restrictions on shore leave. Details are just not there yet, but that seems to be the way people are thinking. I know, Donnie, if you wanted to comment on that.
Thanks, Admiral. I'd agree with you entirely. I just want to thank Leslie for the question. I think it shows the kind of creativity with which solutions can be considered and maybe adopted in the future. But it's also, signifies that level of commitment that you and others have to the well-being and taking care of seafarers in such an important way, a necessary way, that it could be one of many different creative solutions that that kind of help define a new paradigm within the industry. And so thank you for that suggestion.
A second question I have, and before I'll ask that question, what I want to tell attendees too, we can hear your audio questions, and it would be great to hear your voice from different parts of the world. And the way I know that you have that question is that you can raise your little hand. There's a little hand that symbol that you can raise, and I'll know that you're able to speak. So if you have audio connected, then we can do that. You can raise your hand, and I'll get to you as soon as I can. Once I see your hand, I'll acknowledge it. The second question comes from Karen Parsons down in Galveston, Texas. Do you think it will be hard to get crew members back after the experience of being stuck on their ship for so long during this pandemic?
Well, that's a really intriguing question, because I don't think we know yet. I mean, certainly crew members were not happy about being detained on board ships when they just wanted to get home, especially after employment contracts had expired. They just wanted to get home. One would hope that as international travel restrictions are eased, that it would be much less of a problem getting crew members back than it was to get them home when restrictions were being imposed. But I think it's something of an unknown right now. I do believe that crew members do want to get back to work. Many of them, I mean, it's their livelihoods, and that's how they take care of their families. So I think there'll be the desire to get back to work, but I think it's reasonable for them to want to know, under what conditions, will they be able to get to and from their ships? Will countries abide by their international agreements regarding, crew repatriation, access to medical care, and so forth? That is certainly something, we're seeking to be a voice in favor of. Coming up on the International Day of the Seafarer this week, I mean, that is something that I think a lot of maritime organizations are reinforcing that message. So, for the international maritime system to work, crew members need to have that assurance that they can move freely between the ships where they work and their homes.
I would just add that I think crew members, like future passengers, will want to have that assurance that the environment that they're heading into on board a ship is one that's safe and clean and healthy. And crew members largely know, because they're all such an integral part of it, the onboard procedures for maintaining health and a clean environment through the important work that they do every day. I think that there should be a recognition that those measures will only be enhanced once through this period of suspension and when passengers come back on board, so that they too can have the assurance that that's a safe environment. And I think that remains an important part of the work that cruise lines are doing as they maintain the ships now and prepare for return to service. They know that those assurances need to be provided, and I think we'll communicate that not only to passengers but to crew as well.
Next question from Markus Wichmann in Germany. Marcus, I'm going to open your microphone and you can ask your question. Hello, Marcus.
Hello, good afternoon. You can understand me?
Yes.
Yes.
Yeah, good afternoon from Hamburg, from Deutsche Seemannsmission Seafarers Lounge at Cruise Center Steinwerder in Hamburg. At first, 30 minutes ago, we had a very emotional moment here at the cruise center because 300 crew members from cruise ship Aida Blue left the ship the first time since 120 days. And they get the permission to land in Mumbai. They are going to the airport now, and it was a very emotional moment because the company knows that they not only can land in Mumbai, they also can, they bring the crew members home by buses and trains. And that was a very emotional moment here 30 minutes ago. And yes, Mr. Salerno, he also spoke about the suicides. We had one here at Ida Blue a couple of weeks ago. And yes, as we all of us know, the psychological healthiness, it's necessary for the crew members to get in contact with their families by the internet. And I know that there was an agreement between the ITF and the cruise companies that the internet should be for free during this COVID-19 period. And I'm a little bit disappointed from a couple of companies that the internet is still, that the crew members have still paid for the internet. And so it's not a direct question to you. It's just I want to speak about my disappointment that some companies still take money for the internet. And you know, many crew members don't get money because they have no contract anymore. And yeah, it's a problematic situation for the crew members. But as I also said, it was a great moment 30 minutes ago that it's yeah, more and more crew members can fly home now. Thanks. That was it. Thanks for this organization and for this webinar. Thanks.
Yeah. Well, thank you for sharing that information with us. Both the good news that seafarers from India will be able to go home. That has been a barrier, as I'm sure you know, for quite some time to get Indian seafarers back home. As for the internet, I was not aware of that, so I appreciate you sharing that information with us as well. I think part of the psychological health of seafarers is that feeling of being connected, the ability to communicate with family back home. And it's maybe one thing when they're receiving a paycheck. When they're not receiving a paycheck, that makes it far more difficult, maybe even impossible. So again, thank you for letting us know about that.
So for the next question, I'll go to Natalie Shaw of the International Chamber of Shipping. And Natalie, I'll open up your microphone. Go ahead, Natalie.
Hi, thank you. I just actually wanted to take the opportunity to respond to our colleague from Hamburg as well, from the ICS perspective. I know that Donny has mentioned some of the work that we've been doing. I too am certainly not aware of any agreement with the ITF about guaranteeing that there would be any access to the internet during this period of time. I'm not aware. It may well be that IMEC may have agreed it for IMEC companies, but it's certainly not being agreed on behalf of the industry. What we have said as part of an industry welfare group is that we're certainly encouraging companies to provide it. And we've made that very clear to our members, and I'm sure CLIA likewise have done that. But we have not, there is no agreement in place to say seafarers have an automatic right to the internet, nor is there anything within the MLC about that. So I just wanted to clarify that. I'm not aware of any official agreements that have been made in that regard. With regard to some of the challenges that the crew are facing and the Indian crew, I can assure you this is a big problem that we're trying to resolve globally. And again, this is actually down to the Indian government in lots of cases, because they've been the ones who've been unable to actually be able to repatriate their own people. So it's not through lack of trying, it's actually down to the restrictions at the Indian airports, and then the same is happening in the Philippines as well. So as an industry, we are working extremely hard to try to influence the labour supply countries to take their responsibilities towards their seafarers much more seriously, and to help to facilitate them going home. So this is something that is really down a lot, unfortunately, is a lot to do with the countries themselves. Thank you.
Sorry, thank you so much, Natalie, for those comments. And I'll just say, indeed, thanks to Natalie for all her work in in this crisis. Natalie's been one of the key people organizing meetings for the last number of weeks, thanks to the International Chamber of Shipping, the ITF, and CLIA and others for being on those calls every week. I've enjoyed participating in them and hearing those different voices. We have a number of questions sort of following on from Natalie's questions and comments. There are 2 or 3 questions on the internet and the provision of internet for mental health. But then a few other questions. I'll ask 2. One from Father Paulo Prigol. First, Father Paulo runs the Stella Maris Seafarer Centers in Manila, in the Philippines, and so has a front row seat to those who are trying to sign off and have fairly big problems. His Father Paulo's question: are there programs and or services that we can offer to the families of cruise ship workers repatriated to the Philippines, since now the breadwinner is jobless? This will be a big challenge for many, what to do. The second one sort of is a follow-up on this from Jacques-Henri David down in Mauritius, if I'm not mistaken, about crews recently disembarked and want to voice out their trauma. How to manage this kind of meeting about the trauma that they've experienced? What proposals might be out there? What can we do for those crews who have just gone home? And a third one, which is similar but slightly different, from Reverend Tay down in Australia. If a crew sign off and they get stranded somewhere in a country, whose responsibility is it to care for him or her if they haven't got quite all the way home? How do we care for them? So about crews going home, and then about their mental health once they get home, also their job situation once they get home. Is the cruise industry doing anything about these issues? And what proposals might there be to do something?
All good questions. I'm not sure I have really in-depth answers to any of them. I think on the last one, as far as crew repatriation, my understanding is that under the MLC that they are entitled to repatriation, and that is a cost that is borne by the company that employs them. So the intent is to get them all the way home. And Natalie could probably correct me if I'm wrong on that, but that is my understanding. I think the issue regarding Mauritius has been extremely challenging for our industry. Mauritius is one of the countries that has erected some pretty significant barriers to getting people home, limiting the aircraft that they can fly, and they have to fly on Air Mauritius, which has a very limited number of airports that it can fly to and from. So you have to get to an airhead where they service. They only fly several, maybe several flights a week, different places. And then when they get home, there's quarantine measures that have to be prearranged. And the cruise lines have been, from everything I'm hearing, are willing to do that, but the barriers have been so difficult that just logistically, it's very hard to do. If you have, for example, 2 or 3 Mauritius crew members on one ship, and there's maybe 2 or 3 on another ship, not too far away, you try to combine them to get on a single flight, that's been very difficult. So it's been a problem. So I think the emotional strain on seafarers from Mauritius has been pretty high, and I could certainly understand why they would want to speak out about what they've experienced, and certainly with a view towards how could we make this process move a little bit better. Caring for seafarers once they're back home, again, I think that's probably something that might be very company specific. There may be social programs within the country that I'm not aware of, but I may have to leave that one to others to address more fully.
So a couple difficult questions on these suicides that have come up. So it's been reported in the press. a number of suicides. And I'm wondering if the cruise line industry, if you could report on how many of those, how many suicides are you aware of in the industry in the last few months? What sort of is the industry or those companies doing about that situation? How much do they pay attention to those cases? And what happens in the cases where there are suicides to the widows or the widowers or the family? If you could say anything on those on these very sad cases, how to help the widows or the widowers of those suicide victims.
Maybe I'll just make a comment or two and ask Donnie to chime in. I don't have an exact number. I know that there's approximately half a dozen. There may be more. I've heard up to 9, but I haven't had confirmation on all. But of course, we don't even want one. You know, there's no acceptable number there. The fact that they are occurring has received attention at the highest levels within the industry. You know, the senior executive at the cruise lines, this is something they've talked about. They're extremely concerned about this. Taking care of crew members is something that, I mean, it's essential from a business perspective. You know, you cannot give passengers an enjoyable time on a cruise ship if you have crew members who are unhappy. You know, so there's that old expression, happy crew, happy ship. You know, taking care of the crew is just fundamental to the way the industry operates, and that extends to when, you know, during this period of operational pause, you know, you have to take care of them now, especially so that they know that the company is concerned about their welfare. We do have a group that we interact with on a regular basis, a medical group within CLIA. It's comprised of the senior medical officers of all the cruise lines. And this, you know, and Donnie chairs that group, so I'm gonna let him talk about it. But this has been an issue that has come up repeatedly, and they've been extremely concerned about the effects on crew members during this operational pause. And I'd maybe ask Donnie to comment a little bit about that.
Thanks, Brian. Yeah, this group of medical professionals certainly are well aware of not only suicides that result on board, but increased feelings of isolation or tendencies towards self-harm, you know, need for psychological disembarkations from time to time. So it is something that has their full attention, and looking for ways to mitigate the impacts in the environment in which seafarers currently find themselves as a function of COVID-19 and the suspension and the barriers that are present towards getting folks home to their families. Remains, you know, a critical element in order to mitigate those impacts. I've also talked with, you know, designated persons ashore for companies where there's been a suicide on board, and you know, that would often be in the very immediate term right after it's happened. You know, there's always questions on whether it's directly attributable to the current circumstances or whether there was an underlying issue. But in any event, they're tragedies that the companies deal with, that the ship needs to deal with, and in addition to trying to help manage the impacts of that loss to any family for the individual, there's also the potential negative impacts just on the entire crew morale on the ship, which remains something that the ships, you know, very much try to manage in a way because they recognize how much pressure, scrutiny these individuals are under on board, and want desperately to be able to provide ways and relief for that. By one example, you know, these kinds of situations have impacts that go well beyond the skin of the ship too. one crew member had a spouse on a different ship, different line, a sister on another line. So these kinds of situations have wide-ranging impacts on people in our industry and ashore, and they are not easy. So the companies are fully cognizant of that, and it factors into how they manage their communications, how they manage their interactions with the crew, with the families. Very hard circumstances all around. Like Brian, I'm not sure we have full visibility on all the situations, but it is remains of paramount concern, and the best way I think that we can progress is towards finding relief to some of the barriers to getting folks ashore, because we have seen that crew are very responsive. Seafarers are very responsive to the availability of information about what is going to happen to them, when they'll be able to get somewhere, when they can communicate that there's an end in sight. That information remains vital to their morale and their well-being. So continue to look for ways to provide more certainty in that regard.
So a question from Father Celestin Ikamba, who is the Stella Maris Regional Director in Western Africa. Once cruise ships start sailing again, is there going to be a reduction to the number of passengers and crews? And will this be something that all of us need to be aware of? Running cruise ship centers, will there just be less crew for a certain amount of time that we might be seeing in our seafarer centers?
No, good question. I think that's still to be determined. Certainly, it's on the table for discussion as cruise lines consider, how they might implement social distancing requirements. One of the ways of achieving that is to reduce the number of people on board the ship. That's just an obvious, almost a geometrical answer to the problem. But I will have to stop short of saying that that's going to be, a standard throughout the industry. I think it's going to depend in large measure on the company, the configuration of the ships, and how they can carry out social distancing expectations in accordance with local health authorities in the ports where they visit. How shore excursions would be allowed and so forth. So it very well may be that, but it's a little too soon to say definitively that it will be like that for everybody.
So we have a limited amount of time, but still lots of questions from folks. This is great. So I'm going to start with Matthias Ristau. He's been waiting the longest to ask his question. I'll open your microphone in just a moment, Matthias. Then after that, I'll get to Peter Tomlin, and then to Stephen Cushing, and around to Doreen Badeau, and hopefully we'll still have time for Franklin Isaac, and I'm sure that we'll be butting up against the end of our time. So Matthias Ristau from Hamburg, Germany. Go ahead, Matthias.
Yeah, hello, good afternoon. Thank you for this webinar. As we are talking about crew welfare, I would again ask about the possibility of internet access and Wi-Fi on the ships, because everybody knows that for the welfare and well-being and mental well-being of the seafarers, it's very important to have communication with the friends and families, and also with chaplains or other people social workers who can care for them. And we heard of some cruise ships where the Wi-Fi was turned off, and others where the seafarers have to pay quite a high price, but the quality is very bad. So that even some seafarers from a cruise ship borrowed from us Wi-Fi boxes to get some Wi-Fi, or if they can go ashore, they are very keen on buying SIM cards, but in many places it's not possible. And I talked also with somebody from the communications company, so the Wi-Fi or the internet access for cruise ships is not that expensive anymore. And if the cruise companies care for their crew, why internet is not for free for all of them?
Thank you, Matthias, for the question. Brian or Donnie?
Yeah, I would tend to agree that I think the ability to connect with family members back home is really critical to crew member well-being. I am not aware of which companies are not providing it. I know many are very happy to say that they are providing it. So clearly that's not 100%. So very much appreciate you sharing that. It's something for maybe us to discuss further with some of our members. Unfortunately, there's not an association mandate for that. It's very much a company specific decision, but I think the rationale that you've expressed is one that I personally find compelling. I think it makes a lot of sense, and it is something that we can certainly convey on to our membership. I don't know, Donnie, if you had any additional thoughts on that.
Thanks, Brian. Nothing additional, but I share your sentiment and certainly views that we can convey, views and concerns that we can convey back to our members for consideration. Thank you.
Yeah, I'll highlight that this is a big question from a lot of the members here that I'm finding this one. So if you could indeed pass that on in saying that this is something fairly, we're saying fairly forcefully that more internet access would be useful. I think that would be useful. Next
that's a very good takeaway for us. So again, thank you for raising it.
Next, Peter Tomlin from the Merchant Navy Welfare Board in Southampton, UK. Go ahead, Peter.
Thank you very much, Jason. Hi, Brian. I think we met when I was in the States last time, and Donnie, thank you, Paul, for arranging this. This week in the UK at London Port of Tilbury, 4 of 5 cruise ships alongside have been detained by the Maritime Coast Guard Agency, and all have experienced crew welfare issues, and that's just one port in these difficult, unprecedented times. What do you think the ICMA welfare organisations can do best to support the cruise industry and, of course, its crew members now and in the foreseeable future, when hopefully the situation eases? So the question is really, what can we do for you?
Well, thank you. Appreciate that willingness to assist. I think certainly if you could communicate to us, when you're seeing those types of issues, we could relay those concerns to companies. Communicating directly with companies, I think, would even be more direct and potentially even result in swifter action. I think both avenues would be good. I think it's always a little bit challenging in a time, well, it is a little bit challenging in a time like this where normal interactions between port chaplains and crew members are constrained by public health reasons to even provide the kinds of assistance that you normally do. And so I guess we're all having to be a little bit more creative. But the ability to, somebody mentioned earlier, bringing even Wi-Fi equipment on board, to help people communicate, I think is a very creative solution where that's possible. I don't know, Donnie, if you had any thoughts on how best to do this, but I think communications is the key.
Yeah, thanks, Brian. One area that we've seen a number of communications made by, whether it's from seafarers themselves or from their family members ashore, speaking for individuals or even on behalf of certain nationalities of crew members. We know a number of these concerns get raised to the International Labor Organization and the International Maritime Organization. And there's a network by which those organizations make us and Natalie from ICS, they inform us of what's been raised. And that's been an effective way to give visibility to an issue or a potential issue, and a way for an organization like CLIA to address with a member line, can you give us some context around this? Can you inform us about what kind of measures you've taken or actions you've taken to say repatriate, seafarers of this nationality home. And that kind of dialogue has worked, and that's just an example of, I think, the kind of communications that Brian is talking about. We appreciate learning. Often where we are a few layers removed, we don't necessarily hear the whatever the request is from the seafarer or the need as much as those in a position closer to them will, and maybe that's you in the port environment or the ministry environment. So we appreciate you making those known to us so that we can raise those and be part of the communications process and inform a dialogue on important issues like the ones raised today.
A quick question. I know we're coming up to the end of our time. We might have time for one or two more, but when you say communicate with us, specifically, how do our members communicate with you? Do you want me to share your email addresses, or is there some other way to inform you about these things? How best would that happen?
I know from my perspective, Jason, we have a long history of talking to each other. It's helpful if we remain mutually informed. So I always appreciate getting something from you if your members raise it, and that it's a way, nodes for us to talk to each other and remain mutually informed about what's going on within our respective memberships. So if you're amenable to that, then we're happy to receive information from you, of course, directly as well. But I think we maybe are all better off if we keep visibility at our kind of association levels.
A question from Stephen Cushing down in, for me, down in Boston, running the New England Seafarers Ministry. Stephen Cushing, I've opened your microphone. Go ahead with a question.
Yes, can you hear me all right?
Yes.
Loud and clear.
Sorry, my speaker's not working. Good morning, gentlemen, Donnie and Brian. Good to see you again, Brian.
Good to hear your voice, Stephen.
We just had, I'll try to make this brief. It was a longer question, but I know we're running out of time. We just had the Military Sealift Command Leroy Grumman leave port for Virginia. While they were here, they had an outbreak of COVID-19. Half the crew were tested positive. One tragically passed away from that. And in talking with some of the crew members and the captain on that ship, it was pretty apparent that we are looking at a PTSD scenario for many of these crew members. And so even when they do get home, they're going to be carrying with them some scars of being detained on board a ship and the lack of information, the lack of uncertainty, the care. So my question is about the crew members, the maritime crew, who are still on your cruise ships, on the cruise lines cruise ships anchored at sea or near a port. And as we're all sort of learning, both industry and maritime and faith-based organizations, we're learning as we go with this. Have you learned, how are you going to care for those maritime crew who are going to have to remain on those ships unless you cold lay them up, in terms of psychological counseling, communication with home, and eventually repatriating and then restaffing them, which seems to me to be just as difficult.
Yeah, that's again another very compelling question. If we have conditions on board right now that are leading some, admittedly a small number, but again, one is too many, to even take their own life, you can surmise from that the stresses could equally lead to a PTSD type of result and many, many more. So I think that is an extremely important consideration, and maybe one that we could bring to the team of medical experts within the cruise community to ask them to consider how best to treat people who may exhibit symptoms of PTSD and to care for them. I think I thank you for raising that, Stephen. Quite honestly, I hadn't thought about PTSD in this context, but now that you mention it, it makes perfect sense.
Well, everyone, I am sorry to say that we've come up against the end of our time. I know there are still questions from Nikolai Wiebe in Denmark, from Cedric Rautenbach down in South Africa, from Leslie down in Fort Lauderdale, from Dennis Gorecho in the Philippines, from Philip Vandercook down in New Orleans. We have them from everywhere in all places. And so I'm sorry that we can't get to all those worldwide questions or comments. But we're at the end of our time. I thank you so much, Donnie and Brian, for your time. It's really precious to us that you can speak, but also listen to us. As was said, I will remain in contact with Donnie. Donnie and I are both on a phone call at least once a week, if not twice a week, so we can remain in contact. And if you have any comments or questions that you'd like to send to me, to send to him, I will be happy to pass those on. We have some resources for those that are interested on some of the coronavirus things. Of importance, ICMA has put out some guidelines about how to deal with ship visiting, with transportation, and with opening seafarer centers. If you haven't seen those, you can go to icma.as, icma.as. Maybe even the CLIA might be interested in seeing what those guidelines that we've developed are there. Also, on our training platform, maretraining.com, we have a COVID-19 course that's free and open to all, maretraining.com. And thank you to the TK Foundation for the support in making that available. It's a new course that's been taken by a record number of students, so we're very happy that that course has been made available. Thank you all for your time. Thank you, Deacon Paul, for helping introduce this session, and we hope to see you all on another webinar. This webinar has been recorded, and Donnie and Brian have said that we're allowed to share it, so I'll share that link with everyone who's listened and who's registered. Thank you all, and have a wonderful day. Thank you.
Thank you all.
Thank you, Jason.